Sanjay Bhutani, Managing Director, Bausch Lomb India. Bausch Lomb is also a founding member of MTaI in India. So, medical device industry, if you look at the global pharma industry, it's about like $1.3 trillion, and medical devices is about $400 billion. So, which is about 36% of the pharma industry. And if I look at the India numbers, India pharma industry is about $35 billion, whereas medical devices is only $7 billion. So that accounts for just 20%. So going in that parallels, I think even if the numbers are same as the global numbers, so this should be about $13 billion. Overall, like $7 billion versus like $400 billion globally, India accounts for only 1.8% of the medical device industries worldwide. And it's like at a pretty nascent stage. The global medical device industry is growing at 4.1%, whereas India is growing at about 10%, over 10%. Being in nascent stage, I think it requires effort both from the government to handhold the industry, and also on the medical device companies to go out in India and promote the products. So what is required? I think the tax benefits, the legislative and the regulatory reforms in India. On the IP side, I think laws needs to be strengthened before like multinational companies can come and invest in India, to promote what the Honorable Prime Minister is talking about of Make in India. GST bill, the rates which have been announced by the Honorable Finance Minister in November, he is talking about 4-tier rates, which is like 5%, 12%, 18%, and 28%. But I think also there is one more rate, which is 0% for the essential commodities. So if we look at the current rates in the current regime, taking like VAT, excise, and customs duty into account, the current rate, the blended number would be about say 9 to 10%. And then the service, which is a very smaller part of any medical device equipment, the service tax rate is about 15%. So blended rate is about maybe 10 to 11%. So we are hopeful, though the finance minister has not announced like where actually the medical devices would fall into which category. So as an industry, we are kind of contemplating and hopeful that it should be around like 5% rate. Though like because it's a medical device, many of the medical devices are life-saving, and considering the affordability and the poor people in India, the rate should be 0. So let's wait for and see like what more announcements come in. But our recommendation is that the rate should be 0 in India for GST. Couple of things I think which are there, I think which requires attention of the government. So let me start with, I think the first one I've already talked about, that the GST rate on the medical devices should be like 0%. If we look at the current what's happening, in the current regime, the hospitals are exempt. Though in the rates which have been announced by the Honorable Finance Minister, he's not talked about the exempt category. In exempt category, what happens? The hospitals, they're buying services, they're buying pharmaceutical products, they're buying medical devices, but in the end, they're not allowed to charge it to the patient. So patient can't see. He feels like the healthcare services what he's getting from the hospital is at a 0 rate, but actually the rate is kind of embedded into the bill because the hospitals are not able to pass it. And that accounts for almost like 9 to 10%. And in a country like India, where the affordability is an issue and more poor people, I think 9 and 10% is quite high compared to other countries in the world. So first recommendation, I think, instead of maybe exempting the hospitals, they should be made a zero-based GST rate, which could be like done in two ways. Either maybe you make the entire supply chain at a zero rate, but I think more prudent would be where you tax on every logical step on GST, and then the hospitals are able to claim the refund. Under exempt category, they are not able to claim the refund, and the laws should be like maybe very simpler for the hospitals to claim the refund. So looking at any country which has like VAT or maybe GST, like talk about like countries say like Canada, Australia, Singapore, where they have introduced GST, it's been like very simpler. The rates are very lower. They have ensured that there is a competitive uh, uh, advantage, not advantage, maybe the service providers are in parallel. For example, in India, between government and private healthcare, the GST rates, if the private hospitals are have a zero rate, then I think they are on a level playing field. The compliance rules are much simpler, and the administration part should be easy for them to like claim the GST refund. So that's one. Second is the GST rate for the medical devices should be zero, and the reasons known, because 9 to 10% the affordability issue is there. The third point in the GST I would like to talk about is, um, as a medical device industry, there is like a lot of demos required. It's not easy to maybe sell any equipment without the doctors or the clinics having the first-hand view of the product. So they would require a demo, and which in times like takes like 1 week to maybe going up to 60 to 90 days. So right now the rules, the draft rules talk about that there would be a GST on the demo equipments, which would unnecessarily kind of increase the cost. One, even if it is like claimable, you can take it back. That would unnecessarily block the working capital of the medical device industries. So, for example, what maybe the government could look at is demos for say 62 or 30 to 60 days are exempt from paying GST, and if it is like beyond 60 days, then you can like always claim back. So the government should look at also what needs to be done with the demo. There are like many other things which are kind of common to the other industries. One is what would happen to VAT or the excise or the customs duty, which the companies have paid on the stock which is already there with the distributors or the market. The other fact is the GST rules currently talk about that GST is payable on advance, or once you like kind of invoice the product, or the delivery happens. So whichever happens first. So I think where the companies have different products which have like either different dutiable rates, there would be a challenge in terms of how do you manage. So it should always be on invoicing, like the current VAT regime. And one more important factor I think is about when any surgery is happening, there are like multiple parts which goes into a surgery. Like you give consumables, for example, an IOL in a cataract surgery, or maybe stents in a cardiac surgery. And plus there are drugs which goes into a patient's surgery, besides the service, which is actually the surgery charges. So which forms like a work contract, and the supply, and you are actually not transferring the property rights into the consumables to the patient. So it actually should be treated as a part of service and taxed accordingly. So as I mentioned that the industry is in a very nascent stage. It accounts for only 1.8% of the total medical device worldwide. Any price controls coming in on the products would like maybe further impact in two ways. Maybe it would make the business unviable for the multinational companies in India, and you can't like maybe buy or pay price for apples for the oranges, though both are fruits and have maybe different nutrition value. It has to be like different. Otherwise, the advanced technological products would not come into India, or the companies would maybe bring in lower quality products which would impact the patient's health. Custom duty increase has a significant impact on the medical devices. It has been increased by 7.3%, which accounts for almost like 63% hike on the medical devices. So if you are not maybe lowering the custom duty, this is kind of impacting the patient cost. Also on the parallel side, it would maybe encourage smuggling from the neighboring countries, where the import duty is about like 0 to 5%. So any particular medical device which is like maybe small size and high value, you would see maybe companies, maybe people kind of smuggling those products, and then there are no service and warranty guarantees there, so which could impact patients' health. Key challenges, it's a small size currently, it's 1.8%, and I think the government is going in the right way, where they are distinguishing between medical devices and the drugs, but still I think lot needs to be done. The first part is the custom duty hike, which was there. I think this is the right time when government is coming out with GST. They should look at maybe reducing the GST rate at maybe 5% or 0%, making the hospitals exempt, not exempt, like zero GST rate. Even in the draft rules, we see there are like a couple of challenges in terms of maybe the shelf life, which we are hearing is 5 years, but medical devices globally have like much more longer life, which is 5 to 10 years, and that's the cost advantage. If you can maybe use the device for a longer period, and could be used for a longer period. The UDI, which the US and Europe markets, they're working on the UDIs depending on maybe the risk category, and then would be over by year 2022. So India, for the time being, should keep it in abeyance till the global community is in line with the UDI. And third is the labeling part, where the products you get only legal manufacturer's name, the date of expiry, and the address of the legal manufacturer. But in India, they're saying you need to also get the actual manufacturer's name and the date of manufacturing from the source. So that might impact the overall industry. People would not be able to import because none of the manufacturers are putting that labeling on the medical devices. And considering India is only like 1.8%, they might not do it for India. Make in India is a good concept, I think, but it would require time, and I think the government needs to maybe get to see like what China has done. So they initially kind of encourage multinationals to come to China, and they opened their doors and also asked them to maybe transfer designs, drawings, and maybe facilitated to a great extent. And at this simultaneously also encouraged the local Chinese companies, the startups, to set up plants in India, plants in China. And then once I think the local industry was sizable, then thereafter they came out with the regulations. Okay, any government tender, 50% should be from the local companies. So I think government should look at doing similar things, where once the medical device manufacturing in India picks up and is beyond maybe 50-60%, then that's the time I think they should look at maybe increasing custom duty and maybe putting other tariff barriers on all the multinational companies. But right now I think they should be encouraging by giving like more fiscal benefits, also in terms of maybe the regulatory and the legislative framework, which is maybe not very clear and complex, should be like simplified, and maybe the land availability for companies to set up plants in India. I think those are the areas. Also, one more thing, I think the IP rules in India needs to be strengthened for any technology transfer happening in India. The multinationals would come in if they feel they're like really protected.